Ladies and gentlemen, it's my great honor to give this presentation in this wonderful meeting. As I know, this meeting is 20th anniversary, so I'm so honored. And actually, I was in this meeting for more than 5 times. I remember 5 or 6 times. So it's really nice. As Ximin just introduced me to you, I was an image guy. I did an MR study and a PET study for receptor image. But several years ago, because my position is changed, and my new mission is to make my hospital smart. So I changed to the digital mental health. It's my new life. So today I would like to give you this presentation. I want to give you some ideas about digitalization and the current status in mental health. And of course, I will give you several examples from my group. Okay, this is content. I will give you the reason why and how to digitize current status and the advantages and the future challenge. As we know, the mental status is our mental health is a status, a state marker. It's not a trait, which means most of people you will face once or twice your mental change, such as anxiety or depression. Particularly from the statistic data showing that at least 25% of people will get the psychiatric disorder, such as anxiety or depression, and more than 70% they need treatment or management. This situation is particularly get worse because, after COVID-19 because a lot of people that get depression and anxiety. But the problem is we don't know it's the symptom or disorder change. So it's very important that we should evaluate and give the more powerful and more accessible treatment for them. This is a current situation for psychiatry. Of course, we should interview our patient face-to-face, one by one, or even you can do the psychotherapy, and the people lie down there. And most of the hospital, they have changed. They can use such as iPad to give a test. That's very common. But the situation is a lot of still many hospitals in the world, they use pencil and pen to give the test. So it costs a lot of time and manpower to do that. So we should change our viewpoint and method to treat our patient. So that's the reason. First is an increased need. The second, because the AI era, so we like to prediction the situation, or at least we should have early detection. And of course, if you can accumulate the data long enough, we can find the disease pattern. That's very important. I will give you this example later. So that's the trajectory of digital prediction. First, we should make our old data digitized. So then we can easily use the database. The second is once we have digitized them, we can visualize them. Since if we visualize the data set by figure, it's you will get different feeling and you will have a different treatment attitude. But of course, if we have this data, we can do AI study and we can prediction. First example is, I took the position of quality management in my hospital, which is the biggest hospital in Taiwan. The superintendent always asks me, how about the occupancy of ICU, or the patient when visit our emergency room, we should, how should we to manage our manpower, such as more nurses or doctors. So I first give the data digitization, and then we can visualize the data. As you can see, this is the people number to visit the ER. You can see a lot of people come to in the morning and in the afternoon, and many people they get admission. So the number, the patient number in emergency room will get decreased. So you can manage your manpower. And of course, you can see a lot of indicator. That is the occupancy. That is the occupancy of our ICU beds, because in Taipei Veterans General Hospital, we have 15 ICU in terms of like a neurosurgeon, cardiologist. So the superintendent always wanted to know the occupancy of ICU, because ICU can make money for the hospital. So I can give the ICU occupancy immediately. So you don't need to ask people or to get the data, because it's always delayed, But if you ask someone to give you exact data, maybe I ask this question at lunchtime, but you give the data in the dinner time. There will be 4 or 5 hours delayed. But in these figures, we can see immediately the occupancy. So it's very efficient. Yes, of course, it's the command center, which I made it first in Taiwan. And we can just sit in the room, and we can see this change of the data. So it's an Asian Newsweek present this first command center in Taiwan. Of course, if we wanted to do digitization for mental health, there will be 5 levels. First, since the AI technique rapidly developed, so we have to use existing data to do the machine learning, like a prediction. But of course, the drawback to use those data is the purpose of those data is different. So we only can use that data. So second, we can tracking. We use web or app. We can tracking the long-term mood change or your mental status. But of course, by using web, you can increase your sample size, so you can do the population-based study to see the whole society change. And nowadays, it's very popular to use wearable data, but of course, if you buy the Apple Watch, you can find some indicators in your watch. But we want to do more for our mental status. The last is use the image to help us. That is a very typical. First way is we use existing data to do machine learning and to find out the features. And that's a very big problem, since the database is not for this purpose. So we can do another technique, called generative AI. This technique can increase our database in terms of the small sample size. We can find the pattern and extrapolate this trait, and we can do some statistic. I remember 6 months ago, the president of NVIDIA, who is also Taiwanese, and he said the next generation is to use agentic AI, which can help us make a decision. Then you don't need to use your brain, and the AI not only to analyze the data to you, and they can make decision for you. Okay, so we can use web or app to follow our mental status for a long time, or increase the sample size to help us to know the population change. First, since I have done this one 5 years ago, I make a web, and I put the scales on the web, and you can use it very convenient. And after you stick these every questions, you just submit, and then you can get a response from my web, which that's my comment, and your score, your change. So it's very popular. I think now it's more than 15,000 Chinese use this web. But I give you this is English version, but I have another version is in Chinese. This is very interesting finding. During COVID-19, everyone just isolate in your home, and then but still you can use web. So this is after COVID-19, 2019, we use anxiety, depression, and the insomnia scale. It's a 21 questionnaire. As you can see, these people, the population, it's more than 100 cases in this data. You can see the score is quite stable, but the people get depression, anxiety, and insomnia. And since in Taiwan we have a very good control system, so probably Taiwan is the last country to get the outbreak. That is these days, the outbreak, the death cases increase. You can see the point. But what interesting is the total depression and the anxiety score in the population is decreased. So this is a very interesting finding, and because everyone is afraid of to get COVID-19 during this period. But once outbreak and the population anxiety and the depression decreased, which is maybe we can echo how to explain this situation. Is if no one get infection, everyone is afraid to get infection. But once we know it's outbreak, and I did not get the infection, maybe I don't worry again. That's our interpretation. Of course, wearable devices. It's very interesting. That's 5 years ago we used the watch. It's not Apple Watch. At that time, Apple Watch has not this function. We use wearable watch, and we can measure via skin to see the oxygen level, and we can use this wearable watch to diagnose sleep apnea. As we know, if you have a sleep apnea, you need to admit to a hospital for 1 night, sleep that. But then, if we use this one, a wearable, you can stay at home, because you change the bed, and the data is always changing. So a lot of people, they get admitted to do the sleep apnea test, but it's always get negative. The reason is they cannot sleep deeper. So the data, it's not true. But if you take this watch, you go back, and you can easily lie down in your own bed, and you can feel comfortable, and that sleep apnea is true. And we did 20 cases. We compare this wearable watch and with the PSG, polysomnography in hospital, and you can see we get a very good correlation. So nowadays in Taiwan, a lot of patients, if they, they think they get sleep apnea, they can use this wearable watch, and it's not very expensive. And for the further developed, we need nowadays we retrieve the sensor from this watch, and we can measure the EEG by the brain, and we also develop a tracer put on the penis of for the man, and we can immediately to check your sleep apnea, your sexual function, and you can test the restless leg syndrome. So that's very convenient. We just send a sensor to you. You can do that around the world. You just get a sensor, you keep that, and you put the plug in your mobile phone, and this data will automatically via your internet, your Wi-Fi to our cloud, and we can use machine learning in the cloud to develop, to derive a report to you. Of course, you should use VR. It's also very useful. Today, I cannot show you the VR result because although I bring it, but it's a too large size, the largest file size, so it cannot run here. But now we are doing the VR system, collaborated with Eric, who is the president of this year, this meeting, and we are doing the VR to treat PTSD. It's very interesting. We can use VR as a treatment technique. I think in the future, maybe VR can replace the psychotherapy. Not totally, but most of psychotherapy can be replaced by VR.
大家好，我是周
This is the image. That's me.
我们最近发展的一个技术。
This
我们预
talking
备跟工研
is
院
in
合作
Mandarin.
利用会谈的时候呢，我们脸部的表情，还有我们的声音。
I want to develop is to detect the negative symptom of
运
schizophrenia.
动的摆动，
Since
来协助临床医生判定阴性症状的程度。我想这是一个很重要的计划，因为在临床上，现在精神科医生在判别负性症状的时候，它的一致性非常的差，所以以至于造成我们在治疗病患的时候很难找到一个稳。
Okay, I want to show you that one. Because the voice, I want the voice disturb you. I use the image to detect your facial expression, your voice volume, and your motor function. And I want to use this image technique to detect, to differentiate negative symptom of schizophrenia, because the most difficult for psychiatry is to make the evaluation of negative symptoms consistently. So we wanted to redefine the definition of negative symptom, but I just use Mandarin. In negative symptom, as we know, the definition of a negative symptom, it's nothing related to the language. It's related to your voice, your response, and your facial expression. So I developed this system, help people to evaluate the negative symptom of schizophrenia. I think this finding attract a lot of pharmaceutical company, since when they want to develop the new antipsychotics, they are always facing the challenge is how to evaluate the negative symptom of schizophrenia consistently from different countries. So this system is nothing related to language. It's only related to your emotion, your voice, your facial expression. Currently, we can identify at least 500 spatial features to differentiate normal people and schizophrenia. I think maybe in the future, we can use this facial expression to do the early detection of schizophrenia, which also is very important for us. Currently, we just stop here. We cannot go further because we don't have a good system to evaluate this situation. This is another one we wanted to find the pattern, the disease pattern. So, the gait actually is another biomarker. Everyone, when you work, you have your gait pattern. That's because, sometimes if your friend come to me, you haven't seen his face, but that's your friend because his gait has a very spatial pattern. So we want to use image to find the disease pattern. Yeah, we also try to find out, try to quantify the degree of anxiety. So that's I talk to my patient and we use this technique to see, even you can see I was very nervous, even more nervous than patient, since I'm recording for this tape. So we try to quantify the degree of anxiety by the modern technique. Yeah, so that's the advantages. You can use this technique, increase acceptability and your privacy, and personalized because you can just tap your pattern and to compare with our database. Yes, of course, ethical consideration. You can find some good things I just showed you in the previous slide, but you also can find some negative things, like that will increase the screen time for our patient, and particularly if you use VR to replace psychotherapy, you are easily to get a pseudo empathy, which means the people cannot feel you are truly to empathy them. So that's another challenge for that. So that's my conclusion. I think by using this technique, it can change our viewpoint and our management. Even there are some advantages, but there are some disadvantages we need to face and to change that. So that's my new hospital in Taichung. Thank you for your attention.